So, welcome to this lecture where we will learn how to use the Leksell Vantage frame from Elekta. The Vantage is the successor of the Leksell G frame, and even if it looks quite different, the principles will be familiar to users of the older model. The new model has many advantages. It has fewer parts, it is faster to work with, and it provides a good access to the skull. Further, if you do a weight surgery, it is likely to be more comfortable for the patient, and most importantly, the accuracy seems to be excellent. So, let us have a look at the frame. People have sometimes put the frame on backwards, so remember that the higher part of the frame is the anterior part. The frame has 4 lateral holes for the screws and 4 central holes, and normally we are using the lateral ones. 2 in the front and 2 in the back. When we are performing a standard procedure, it is best to standardize also the frame placement in order to avoid the risk for mistakes. Some will mount the frame with the help of an assistant, but personally I think it's more convenient to do it myself. I will place the screws on a line about 3 cm above the eyebrows, passing about 2 cm above the tip of the ears, and the most slanting parts of the skull should be avoided. Left to itself, the posterior part of the frame will often end up rather high, and you might correct this if you find it desirable. I will further strive for symmetrical placement, but this is not important with the Vantage frame. The Vantage can be placed asymmetrically and allows for very individual adaptations, and you can learn more on this in the lecture by Marie Krieger seen here. Before mounting the frame, we will place the band on the frame. The wider straps goes to the side, and I will place the end of the strap at the lowest white marking. You can later optimize this if necessary when the frame is on the head, as well as the narrow straps. Then lift the frame in the band and place it on the head. Make sure that the band and the frame are placed symmetrically and correct this if necessary, and align the frame so that the holes for the screws are at the desired height. If it is not enough to make changes to the band regarding its position or length, then you can take a hold of the posterior part of the frame and correct it as desired. Try to have the same distance from both the posterior screw holes to the skin, and also for the anterior holes. However, it is not necessary to have the same distance between the posterior and the anterior holes and the skin. That is how I do it. My colleagues, Rasmus and Amar, like to have more control, and this can be achieved by adding a cloth to the medial holes in the frame, crossing in the middle as seen here. The frame is then put on the head and the crossing of the cloth put under the cheek. Together with the band, this will make the frame very stable and introduce an inertia, making it easier to place and keep the frame in the desired position. And this might be especially helpful if you have a sleep patient in a semi-sitting position. With the frame in the desired position, now enter a pen for all of the 4 lateral screw holes and mark where you want to put the screws. Then introduce the measuring stick for each hole all the way to the skin and look at the color marking outside of the frame, not on the inside. In this case, we see a little bit of blue marking, and we are thus going to use the blue screws, or number 4, on the back. Arrange the frame so that you have the same screws in the 2 posterior holes and the same screws in the 2 anterior holes. If you are unsure, then it is usually better to go for the longer screws. Remove the measuring stick, and you can now administer the local anesthesia before or after you have removed the frame. We then open a package with 2 blue screws for the posterior holes and 2 screws according to the anterior measurement. Insert the screw holders with the screws from the inside of the frame, and then lock them on the outside with a ring. Now, with the help of your markings, place the frame in the same position as before. If a screw holder is pressing against the skin, Then start by advancing that screw so that only the screw itself is in contact with the skin. Tighten 2 diagonally opposite screws at a time. It is not necessary to turn the same number of turns. It is better to turn as many turns as you can using a certain force. Change now and then between the pairs. In this manner, the frame will retain its position on the head. You should fasten the screws as hard as you can using 2 fingers, but not more than that. And when finished, remove the band. If you look at the screws, then you will see that there is a blank square in the grooves in the distal end close to the tip. This is of no interest. However, in the proximal end, you will see a narrow rectangle which is of importance. You should never advance the screw so far that this becomes visible outside of the screw holder, since that might affect the stability. If you need to advance the screws further, then it is possible to just replace the screw itself, but the manufacturer recommends to remove the frame and change both the screws and screw holders to the next length. All these steps take about 4 minutes, and let's see how it all comes together in this video. So we start by putting the band in place. And as I mentioned, I use the lowest white marking, but if you prefer to have the frame higher up, you can use a higher marking. We lift it onto the head, and now it's not very symmetrically, so let's adjust that. And I want to place it as I mentioned, so that I have the anterior screws about 3 centimeters above the eyebrows. When I'm happy, I mark the spots for the screws. And then we measure with a measuring stick which screws to use, and remember to look at the color on the outside of the frame, not on the inside. And you can now administer the local anesthesia before or after removing the frame. We take the frame off. And we put the screw holders with the screws in place from the inside and out, and we lock them on the outside using the ring. We lift it back in place, and we correct the position so the screws will be at the markings we did previously. And when we are happy with the position, we start tightening the screws. And now and then we change the position so that the frame will retain its position. and tighten it as hard as you can using only 2 fingers, but not harder. And finally, we remove the band from the frame. It is of course the same when you do it on a real patient, as we see here. But it is easier to explain and to demonstrate how it is done on the model. So I have speeded up this video somewhat, and I am showing it just so you'll see that it is really the same thing. And if you are becoming bored, then remember that repetition is the mother of learning. The next step is dependent on whether you're going to do a stereotactic MRI or if you have already done a non-stereotactic MRI and will proceed with a stereotactic CT or O-arm. Let's start with the stereotactic MRI. Before putting on the MRI fiducial box, make sure there are no air bubbles in the channels filled with copper sulfate on either side of the box. A few bubbles in the upper horizontal channel will not cause any problems, but you don't want air in the other channels. If you see air bubbles, then open the screw in the upper posterior corner with a screwdriver and insert a catheter or syringe into the channel and inject copper sulfate until the bubbles are gone, and then close the screw again. But be careful, because the screws break easily if you use too much force. For a stereotactic MRI, then simply place the MRI fiducial box on the frame like this and lock it in place as seen here. The side that should face in the anterior direction is marked anterior, and it is not possible to lock it in the wrong way. You then add the MRI head coil adapter, a support for the frame, so that it will be fixed in the MRI. This comes in different models, and this is the one I'm using, and you are now ready to perform the MRI and then continue with the surgery. And it is of course the same thing with a real patient. Let us then look at an intraoperative stereotactic CT or O-arm. For this, we first place the patient with the frame in the frame holder. This should be a smooth process as seen here, and if you are using a lot of force, then you're probably not doing it the right way. And it is even easier if you put it on from above. The patient is then attached to the operation table or CT table. The CT fiducial box has 3 pins that will fit into holes in the frame holder. And you simply put it on in this manner and lock it in place. And as seen here again. Regardless if you have done an MRI, CT or O-arm, you will now have calculated the frame coordinates and you're ready to proceed with the surgery. If you need more information on how to calculate coordinates with the Leksell system, then you can find that in this lecture. We now continue with the rest of the Vantage system, which is stored in pieces, and we need to assemble these. and to set the coordinates on the different scales. When setting coordinates without a decimal, simply align the index mark with the number in question on the main scale. In the example here, the index mark is aligned with 112. If you want to set the coordinates with submillimetric precision, then you can use the Vernier scale. Place the index marker at a whole number and then move it slightly so that the desired number of the decimal on the Vernier scale becomes aligned with the marking on the other side. Let's say that we want to set the scale at 112.3. Then we start by placing the index mark at a whole number, that is 112 as in this image. We then push it gently in the direction of the next higher number, that is 113, but we stop before reaching this, at the point where the third marking on the Vernier scale is aligned with the marking on the other side. And as you see here, only one marking on the Vernier scale will be perfectly aligned with any of the markings on the main scale. If you wanted to set the scale at 112.9, then simply continue to move until the 9th marking on the Vernier scale is aligned with the marking on the main scale. Just make sure that you are moving in the right direction towards higher numbers. Anyhow, let us now assemble the system, and we start with the Y scales. These are attached to the frame holder. Make sure that the plastic sheet is stretched above the frame holder without any folds. The left and the right Y scales are not identical, so make sure that the marking with the text anterior is in the corner pointing towards the nose and the top of the head. If it is pointing towards the feet, then you have the wrong Y scale, and it will actually not be possible to fasten it in the frame holder. While your assistant is stretching the plastic sheet, press the screws through the plastic sheet and then tighten them as seen here. Then slide the set scale into the slider. The screw on the slider for the set scale will be pointing in an anterior direction towards the nose. Insert the right set scale in the right slider and the left in the left. There is a marking on the slider demonstrating how the set scale should be facing the slider. And make sure that the markings on the slider and the scale are directly facing each other. Now set the set coordinate on the set scale and lock the screw. Then slide the slider with the set scale onto the Y scale, and remember that the ring of the set scale should be facing in a posterior direction as seen here. Then set the Y coordinate and lock the screw, and repeat on the other side. You can actually put them on the Y scale the other way, with the ring facing forwards, but that has no advantages in a standard procedure. Let us now continue with the support arc and the arc. The arc is simply slid over the support arc and clicked into this. You then need to tighten the screw somewhat in order for these two parts not to separate again, and also to set the X coordinate before locking the screw. This can be done while holding the arc upright or in a flat position at the edge of a table or such. The X coordinate is set by using the large X scale on top of the arc. Make sure that you are using the scale with the numbers directly facing the index mark and Vernier scale, and not the numbers below, which are used for a lateral left approach. You can also have a look at a smaller scale at the front of the arc to verify that everything is right. We then continue with the instrument carrier. This is simply put on the arc, and we then slide it to the desired arc angle and lock the screw. We then slide the instrument guide holder into the instrument carrier from above and lock it in place with the screw. And finally, we slide the instrument stop holder into the instrument carrier from above. We set the desired depth, which in this case is 0, and lock it with the screw. Before attaching the arc to the set scale and the frame, make sure that the screws to the ring clamps and the ring clamps themselves are fully open. If the screws are not open enough, then it might be difficult to click the arc in place, even though the ring clamps are fully open. We will here cover only the placement of the arc in the so-called lateral right position, that is facing forwards. It is possible to use a lateral left position with the arc facing backwards, but this offers few advantages in a standard procedure and will not be further discussed. Put the rings on the set scale on both sides in simultaneously and parallel, and you should hear a distinct sound when the ring clamps locks in place. If it is difficult to get the arc into position, then recheck if the screws to the ring clamps are open enough and that you have set the correct coordinates on the set and Y scales on both sides. Tighten the screws and set the correct ring angle before tightening them completely. We will of course move the arc and change the ring angle during the procedure in order to make the skin incision and such. However, you now have the necessary information on how to use the Leksell Vantage frame. If you would like to see all aspects of the procedure and how it affects the frame, then please have a look at the lecture Implanting a DBS System. This is featuring the Leksell G frame, but there are no differences of interest regarding the surgery itself. I will just show you here how easy it is to do the tunnulation of the connection cable with the Vantage frame. There is no need to remove the frame and redress the patient before implanting the connection cables and the IPG, and that saves, of course, a lot of time. And with that, I end this overview. If you are interested, more presentations are available at the Stereotactic Academy at stereotactic.org. Thank you for your attention.